Welcome to the Pharmacists Are In, a podcast made for pharmacists by pharmacists. Pull up a seat and let's get started.
So welcome everyone to another episode of the Pharmacists Are In podcast. My name is Ajit Johal. I'm a pharmacist based out of Vancouver, BC, and I'm joined by my esteemed co-host, Dr. John Papastergiou from Ontario. John, we are not alone in this episode. We've got some special guests. Who is with you in studio right now?
Very exciting day today. Ajit, I actually wore my lab coat. We're on video as well.
You wore your lab coat?
Special guest. Yeah, I got a lab coat. Gentlemen are in the t-shirt, but I thought, I was debating the tuxedo, but a little bit of a different episode, the segment for us today. Generally, we focus on kind of therapeutic areas and whatnot, but I think we get a lot of requests to do different topics on the show, and I think this is going to be a new inflection point for our show. We're going to try to start bringing some very important guests from different walks of life. And today we've got celebrity in the house, Shamier Anderson, very famous Canadian actor. We're going to introduce him in a second. And Matthew Mazzuca, a health tech innovator. I think one of the young up-and-comers in health technology, health innovation, and his story's pretty interesting. So it's going to be, I think, a great episode. We're going to kind of talk about how you guys have met as well and where your career paths are going. And I think it's exciting to be here today, Jim.
No, it's very exciting. So, Shamier and Matthew, thank you so much for joining us on the show today. As John mentioned, I think our listener base is growing, and I think they'll really appreciate your journeys in life, but also in healthcare innovation. So that's really the theme of today's episode is healthcare innovation. So I'll start with Mr. Matthew Mazzuca. So we were chatting briefly before we kicked off our recording. So you're also a U of T grad, right? So me and John went to the University of Toronto. We won't disclose what years we graduated, but so you did biomedical engineering, and your innovation story is very, very interesting. I think you were saying you started a very successful health tech startup. Most of you who are listening, especially as pharmacists, would know what this is. Tia Health, which you sold just before the pandemic or during the pandemic?
During the pandemic.
Yes, yeah, for sure. Thank you for being here, Matthew. So we'd love to hear your story about innovation. And then Shamier Anderson, thank you so much for joining us. I'm a big fan. I've seen John Wick 4, so we have a somebody, not a Mr. Nobody on this podcast. So thank you, Shamier.
Small movie.
Small, but part of a number of accolades, including for those of you who have Apple TV Plus, The Invasion seasons 1 to 3, Halle Berry's directorial debut, Bruised, for Netflix, and not only just TV and film, but also cultural leader as well, Shamier. So co-founder of the Black Academy and the Legacy Awards, great initiative, and recently inducted into the Scarborough Walk of Fame. So the number one known person in Scarborough is not John Papastergiou, it's Shamier Anderson. So
we argue about that.
It's debatable, isn't it? It's debatable. But I think the other big thing is you've got a really interesting upcoming role for us Canadians, playing Ben Johnson. So I don't remember Ben Johnson because I think it was the Olympics in '86. So I was just maybe a year old. And I remember 88. Okay.
Yeah.
Okay. 88. So I was 2 years old. And my parents still tell me to this day that I would do these mock blocks. I would sprint and I'd be like, yay. I'd be saying gold medal. And then I would say Ben, bad boy. So very... a very interesting story, and I think John was saying that you're training for that role, and you've got some interesting sort of your journey in the health and wellness space has really been accentuated by that. So welcome, Matthew and Shamier, to our show.
Thanks.
And we're so excited to discuss healthcare innovation. So, John, where should we start here? I think
There's so much to talk about, but maybe we start with Shamier because we both grew up in Scarborough. We didn't know each other. Obviously, I'm a little bit older. See, I was probably grade 8 when John said Olympics was taking place, but we kind of happened to meet a couple of times in life, inconsequentially, and then we met more formally, but both went to the same high school, right?
Yeah. The Wexford School for the Arts. It was an arts. Was it an art school? No, it was a collegiate.
It was collegiate. So I was not there for the art program, but yeah, it evolved into a very famous art school now in kind of Ontario, right? And that's where your career started.
Yeah, I started there. I mean, I grew up at Birchmont and Shepherd in a small community housing project called Bay Mills. Went to school at Pharmacy in Lawrence, Wexford, and my mom had sent me there. But at the time, I didn't realize that the performing arts program was going to change my life. And I spent 4 years there, graduated, and actually went to school for criminology, minored in forensic psychology at UOIT, because that was my mother's doing. It was an immigrant woman from Jamaica, so you got to get an education. So I did a bit of that, and then I moved to LA at 21, and kind of the rest is history.
Yeah, and you just say you moved to LA, but I imagine that's pretty brave.
Yeah.
A guy from Scarborough, listen, I go to Scarborough as well, to say, I'm going to jump on a plane and go to LA and make it in the movies. I mean, how many people would even try that and actually become successful? I can't imagine.
It was nerve-wracking. I mean, leaving Scarborough was one. Going downtown felt like I was going. From Scarborough, going downtown felt like a trek, let alone Los Angeles. And so I actually went with my brother, who's also an actor, Stephon James, and we went together at 21 to pursue our dreams. I mean, pre-COVID, pre-strikes, pre all this stuff, and we happened to go out there and just started working hard. To meet people, grow my Rolodex, and really build my career. And so I was very lucky, but also working very, very hard to be able to focus on not only my acting, but my health and my wellness, which is really important for me, from going to the gym and all these things, which is a big health community in Los Angeles. And I got to meet a bunch of people and audition a ton, meet directors, producers, actors, everybody. And then one thing led to the next. And now, I'm kind of here pursuing the dream, living the dream, I should say.
Yeah, I mean, we've had Matt and I had the opportunity to kind of see that firsthand with you. I mean, we went down to LA for the ballerina.
Yes, we did.
For anyone, and I know this generally our listening audience is academics, pharmacists. It's a show very heavy in therapeutic topics, but if they don't know about your career, I mean, it was amazing to me to go to that thing, and I mean, just to be on the red carpet and to see the response of the fans and to be a part of a kind of a movie it's huge. I mean,
yeah, it was the ballerina premiere to spin off the John Wick. And my most important, the best part at that carpet, on the red carpet at the ballerina premiere, just to illustrate this to the viewers and listeners, it's like a red carpet on Hollywood Boulevard. All the big stars are there. And I'm telling you, I brought John and Matt, and those guys worked the carpet like you thought they were supermodels. I just want to be very clear, listeners, that John was the best dressed and Matthew was definitely best dressed. And these guys were, people asking for their autographs and pictures. Let's be honest.
That kind of looks like
exactly.
Yeah, I remember we opened, so we were in this big Escalade, and we pull up like it's all very organized. We pull up to the red carpet, and then Shamier goes, "Get out!" Like, I'm not getting out. So there's all these cameras, and I'm like, and then you got all the fans are watching, and the door opens, and then it's like, boom.
John, you loved it. Don't lie.
John Reeves.
Yeah.
John Reeves.
Cool. Yeah.
Not John Wick.
Yeah, you were there. I'm gonna get it down. You were there.
It was amazing. Yeah, it was quite an ordeal to see. I don't know, like for me, Shamier knows I'm a big film guy.
Yeah.
Watch the Oscars probably every year, and just to go to the Chinese theater, which is where we were, was wild.
Yeah.
It was absolutely wild.
And then walking around, like there's celebrities kind of hanging out.
It actually inspired me because it took the scale of that, the whole movie endeavor, right?
Yeah, it's something. But I mean, maybe rewind for a second.
Yeah.
And how did you get that role? Because I know people are going to ask this in the comments.
Yeah, of course. I mean, the John Wick role, I started my career in Canada, so I want to be clear on that. All throughout high school, I was on so many different shows, notably Degrassi was one of them. If you remember Rookie Blue, Saving Ho. I mean, I'm like aging myself. And Canada was the foundation for my success. Moving to LA, I did a bunch of cool American jobs, but John Wick, I would say, was the one that was the catalyst that kind of changed the game for me. And I remember getting the call. I was at the gym, which is, true to form, love fitness, love health. I was at the gym and my agent called and said, hey man, I got something really interesting that I think you're gonna like. It's this movie called John Wick. I'm like, of course, love that. When am I meeting? When am I auditioning, etc. And he's like, the director, Chad Zaleski, wants to meet you in an hour. I was like, an hour? I'm at the gym, like I'm sweaty. And so I actually had to take my Zoom meeting audition in the boxing gym. So I had to set up my phone, I didn't have my laptop, set up my phone, and I got on Zoom. I had my boxing gloves on, take it off, I was sweating. And Chad's like, what are you doing? I'm like, dude, I'm literally boxing. He's like, wow, that's a coincidence. You planned this? I'm like, nah. And I think it was that moment where he's like, that's my tracker. And so he sent me the script, I read it, and it happened really fast, which is pretty abnormal. Usually it could take months, but this one, I met with him, and literally 24 hours later, I got the job.
Yeah, and this series of movies, just a movie, literally you're part of an ecosystem.
Yeah,
right. It becomes the whole universe of John Wick, and it's really taken off. You met that producer, right? He just don't like you to you. I think that's a chat, Yeah.
I was starstruck. Even when we were first talking about it, I was like, I want to meet Chad for sure. He came up with the whole concept.
Yeah. It's not really welcoming. Like they treated us like we were old friends. So I thought it was really cool. Like people. Matt, Matt looks really young. You look at him, you have the cameras on him today, but you've had quite an illustrious career. You obviously were in software engineering or whatever, your university degrees were, but how did you go down that path to decide, I'm not even going to work for anyone, I'm just going to try to be an innovator and a disruptor?
Yeah, I was in engineering science at U of T. And the way the program worked is that the last couple of years you had to specialize. So I decided to specialize in biomedical engineering and robotic engineering. But as I was going through it, I really just always felt the calling that I was going to do my own thing. Like I tried a few jobs here and there. Then I started working for startups, and I'm like, as soon as I get it, I'm just going to start my own thing. So as soon as I graduated, me and my partner Dave, shout out to Dave, I don't know where he is, but we entered an entrepreneurship program in Toronto, and we just came up with some ideas. Didn't really know, we were kids, right? We didn't really know what we were doing, and we went down. And this is way before it was cool, but we went down the road of building an AI that diagnoses someone. So we built an AI. It was like a 20 questions thing. This is the 2016, so it was like before the whole AI wave, right? And basically, we went into a bunch of doctors' offices, and they essentially laughed us out of the room. Like, oh, why I do diagnosis in 2 seconds? Why do I need your thing, right? But what we gathered is, my story is really a story of just like listening and then pivoting. Yeah. So we listened to that feedback, but we noticed that all the doctors were just, typing on their computer all day, writing their SOAP notes, right? And what we said, we asked a few doctors, like, hey, if we were to hide the diagnosis part, but automate your SOAP notes, would that be useful to you? And they're like, oh my God, that would save me like hours of my time every day. So we pivoted to that. And basically every patient that came in got one of our questionnaires, started selling that. We automated SOAP notes. And we got so much patient uptake in a variety of clinics that, we started navigating, asking, medical clinics that we were partnered with, like, what else can we do for you? So we got into appointment scheduling. We got into, booking appointments, doing constant follow-ups, things like that, referrals. And then we started looking at the landscape. And again, this is like 2017, 2018. We were scaling the business, and then we started thinking, there's like this new wave of virtual care, where doctors or telemedicine, where doctors are seeing patients online. We should go to our doctors and try to get them to do it. So we offered that to a bunch of clinics. Clinics wanted to do it, but doctors were, they loved it. They thought it was great. We were automating the soap note, which was actually more important for telemedicine because it reduces the amount of risk. Doctors would come to us and they'd be like, yeah, I love the platform. I just can't get any patients to do it. So like, is there a way that you guys can market and get patients to us? So then we basically pivoted and we're like, we're starting our own telemedicine company too. And so me and Dave, we did that. We called it Tia Health, and we basically scaled it. At the time, prior to COVID, it was all private because there was no OHIP codes, right? So, it was kind of a convincing patients and doctors to do a private service in Canada, but we could see it was the future. And then basically as COVID hit, we were already on kind of like a ramp trajectory, but they introduced OHIP codes and it kind of just exploded. And at that point, we became one of the biggest, clinics, telemedicine clinics in Canada. And yeah, the rest is history.
Yeah, it's funny how, people see the success at the end, right? But they don't realize how many, times you have to shift direction, change.
Totally,
Yeah.
John. I think there's two really key things hearing both of your stories that I think our listeners would be very interested in. And John and I have interacted with pharmacists at all stages of their careers. So John's a professor at both Waterloo and University of Toronto. I'm a clinical assistant professor at UBC. So a lot of young pharmacists, and I've talked to John about this at various global meetings we've been at. We're like, they just don't dream big enough, right? They don't think big enough. And it's really great to see how both of you thought big with your passions. And I think we need more of that in our profession as well. And that would translate to better care for patients. The second thing I really wanted to hone in on what both of you said is both of you in your journeys to success faced a decent amount of rejection. I know, Shamier, we talked about the role that you got, the audition that you nailed, but how many auditions did you go to and didn't get the part, right? So it's like, how do you push through that, knowing that, hopefully the next one, how do you tweak your, do you stay true to yourself, or do you try and conform to what the casting director wants? It's always something I've wondered about. And same thing with you, Matt, going to doctor's offices, and getting laughed out with your idea, which eventually exploded. So I'd love to hear more about how you handled that rejection, turned it to strength. Because the one thing me and John have always found is pharmacists are afraid of rejection. They're afraid to recommend something because the patient won't want to pay for it, or they might say no, even though it's in the best interest of their health. So I'd love to hear more about how you channeled that. I guess we'll start with Shamier.
Yeah, rejection. I think we handle rejection well because we're from Scarborough, right, John? But no, it's something that I think it's why I've really connected with John and Matthew here, is because our perseverance amongst, adversity, amongst rejection, amongst not taking no for an answer. And I think that's something you just can't teach. And I think as I was flying the plane and building it at the same time, is a term that I use as my career. It's something that I take great pride in now. I think sometimes in the moment, I'm sure Matt and John can, relate, is when you're in the process of going to those doctor's offices and going to school, you get discouraged because, there's so many obstacles in front of you. And I think what folks tend to forget is no one is there during the workout, but everyone's there for the glory. And I think to get to the glory, it's countless commitment, sacrifice, and time. And so to answer the core of your question, the rejection is, as the more you get it, is the more your skin gets thickened, it calcifies, as I guess the clinically correct term would be, you know what I mean? I ain't no doctor, but I think that's kind of what that is. And I think as you grow into this, you lean into that. For me specifically, everybody has their own journey. I kind of take no as the first opportunity to convince a yes. And so I've just really been able to understand that, and it doesn't affect me the same way. I'm still affected. I'm a human being and I'm a sensitive artist, but I still try to find ways to circumvent it. And then the simple answer is, if you get 5 no's, then it's like, F them. I don't want to swear on your podcast, but it's like, F them, let's move on to the next. And I think this is why Matt and I really get along, because he has that go-getter mindset. and we'll talk about our partnership and what we're founding later. But I think it's a like minds attract, and that's why I'm really, into working with Matt and his team and John, because we understand what rejection is, and it doesn't really phase us the same way that it probably used to when I was a lot younger. But hope that answers your question, Ajit.
No, that's fantastic. That's exactly what I was thinking was the case. No, I'm kidding. But no, that's great. How about you, Matt? Because I know that doctor detailing is always
Yeah, it's
long.
not.
So
It's not, yeah, it's a little bit of everything. Like I feel like Shamier said, me and him are, although in completely different paths, are very much kindred spirits in the sense that doing something entrepreneurial is essentially also becoming an actor, a successful actor, right? Like it's not so much just the individual rejection that you get, but like the holistic stuff, family pressure, societal pressure, things like that. But the way that I always saw it is, I always like established essentially a North Star in my head of like what my goal was and like what I wanted to achieve out of whatever the initiative, whether it's the company or in my own life. And I like to think of like the steps it takes to get along there, to kind of break it out into like a very discretized type of pathway. I guess that's the engineer in me. But when something goes wrong in one of those steps, you just kind of find another avenue. So like to Shamir's point, it's a very similar way I see it, is that instead of, saying, taking the negative or something, I always try to spin to a positive. Like if something negative happens, oh, well, we learned this from this, so let's try this and see if it works, right? But in the same way, you become calloused, I guess, to use his parlance, right? Like being rejected is kind of just part of doing anything at scale. It's kind of my view.
Jim, one of the things I've noticed, and I think you touched upon, like the challenge with health professions is many really smart people go into them because they think it's a safe place to be, right? So
Yeah.
they go into pharmacy, they go into medicine, there's all these allied health professions, and they kind of fall into this kind of framework that hasn't really changed. Like again, we still fax things in pharmacy. You know what I mean? Like we're dealing with facts with doctors on faxing things back and forth. I mean, when you look at the efficiencies, and the one thing I've noticed, being around health tech innovators for a bit now, is they'll see a problem and they immediately say, like, why do we do it this way? How do we fix it? Right. And, some of these solutions that, guys like Matt are proposing are really going to change the way patients access care. And I think, our side of the coin here needs to figure out, okay, how are we going to evolve with them, right? Because the current healthcare system, the way it's set up, can't handle the volume of people we're seeing, right? And there's no magic solution. There's not enough pharmacists, not enough physicians, there's not enough clinicians. Like, we've got a real problem with access to care, and it's so interesting to see that approach, That's
totally.
I mean, yeah. So Shamier, so you're in, I think of you now, I know you well enough. I see you, obviously you're an actor, you're a well-known public figure, but you're also a bit of a businessman as well. I've noticed that. I mean, and I see you like that also, right?
Yeah, I always say that if I wasn't an actor, I probably would have went to Harvard.
Yeah.
Or did business, but yeah, I really love business. People ask me what's your favorite movie, favorite TV show. I watch those things for sure because it's the business that I'm in. But I watch Shark Tank. Like that's what I've been. I've been Shark Tank. I've read all these guys' books, and I just really appreciate entrepreneurship. I would also say and argue that being an actor is also being an entrepreneur, right? And so for me, it's why the acting component is one vertical in my repertoire. But I do have a producing business. I have a production company that we founded that will produce some incredible stuff. Producing the Ben Johnson series that we sold to Paramount Plus and Game TV, and just finding different ways to access my business within the arts, but also outside of it. And I think that's the catalyst of our relationship is finding different ways and ventures, akin to other folks. George Clooney has his tequila line, Kevin Hart has, the restaurants, and everyone has their thing. So, I really love business. And I think in this marketplace, in any sector, you have to be innovative. You have to find, you guys are doing podcasts, or I'm still doing podcasts, and so I think it's something that it's kind of, very, true to form in my business now in today's time.
Yeah. I mean, I imagine you get approached, being a well-known figure, to get approached probably with kind of stuff. And so I got to figure out which way to go. You know?
Tons of stuff. I got this idea, this movie idea, this TV show idea. You know, that person, this person, he's got to like nod, wave, and smile. But yeah.
Yeah, no, it's interesting. And then I guess part of all this, and we'll get into kind of your newest venture in a bit, but is this idea about health and wellness, longevity. I know it's important to all of us in this room. I think we've all spent a lot of time talking about that being such an important part of, you know, I think where public health is going. I mean, I've seen in the last 5 years this big change where people, you know, are moving away from, you know, hitting bars, drinking, you know, partying to, you know, you see coffee DJ parties now. People, you know, all an explosion in the health and wellness sector with all these, you know, it was just a whole bunch of just gyms, now you see gyms, Pilates, boxing studios, all these other things, right? So there seems like the next generation is super interested in health, wellness, and longevity, right?
Mm-hmm. 100%. It's really important, whether it's preparing for a role, you know, or just preparing for anything. And it's why I look at it like performance beyond athletics, you know, and I think for me, I'm a performer, but I'm also an athletic artist. And so I got to be very mindful of my instrument, be mindful of my body and what I ingest and how I deal with my everyday, because it affects my roles and affects what I do, you know, and the characters that I play. I mean, Christian Bale's famous for it. You know, he gets really, really skinny and then he gets really, really big, you know, and so I think it's something that we have to be cognizant of, me at least.
Well, I remember, right, you were in the middle of filming Ben Johnson, and we went and met for dinner or whatever, and I hadn't seen you in a bit, and I said, holy shit, you look huge. I mean, like, from the last time I'd seen you, right? So, I mean, that was in a super long period of time, and you were able to kind of really change your appearance in a pretty short period of time, right?
Yeah, sometimes we don't have the most time to transform your physique. So this is why it's so important to surround myself with professionals that are able to help me do it in a very healthy way, right? And I think that's why I love what, you know, we're doing at Stealth Health. It's important for me because you got to do this or you're not going to have longevity, right? I think that's really important, is the recovery and longevity component of this, and making sure that if I have to transform for a role within a matter of weeks, days, that I'm doing it in a way that I'm not going to die the next day, you know?
Yeah, so for sure. And Ajit, I mean, Vancouver's very different to Toronto. I think like the general public in Vancouver's kind of got behind this a little bit earlier, right?
Yeah, you know, we're a very sort of health and wellness focused culture here. You know, we have access to mountains, oceans, so there's a lot of outdoor activities. Our climate is a little bit more temperate, so yeah, there's a big culture for things like yoga, wellness, hiking, outdoors. So that's definitely something I see here. And when I do go back to Ontario, it's very hustle and bustle. So everyone's just kind of hustling, but you got to have that work-life balance. And I think Shamier, you alluded to it so well with, you know, staying true to yourself, but also like taking care of yourself too. And we tell that to our patients because everyone's body is an instrument. So they may not be preparing for certain roles or taking things to that extreme, but you got to have quality of life, right? You don't want to be broken down and yeah, say you live to your 80, but do you want to feel like crap, or do you want to be able to lift up a piece of luggage into the overhead and go up a set of stairs? Those things matter, especially, you know, as you live longer in life. So very, very important. But we'd love to hear more about these ventures, and we will do that on the next episode with Shamier and Matthew. You don't want to miss that episode.